Hi, this is Charlie. This is Tong Ren to fix body parts. Let's just jump right in. You know, things might be the result of a little virus, a little contamination, something that's in your system. So first we want to do clean out, clean out, clean out. Triple warmer 16, 17, both sides. And triple warmer 20. You know, whatever, you might have had an infection, it might be anesthesia, anything that's clogging the muscles, the nerves. We always want to open up the drain pipes before we start doing anything else. And the next thing we want to do, because it's going to support repair system, is oxygenate. So phrenic nerve, large intestine 17, 18. Both sides. Gallbladder 12, both sides. And when I'm there at gallbladder 12, I like to be able to also just slide over because it's right at gallbladder 20. It's serotonin, it's sleep. If you're in pain, that messes up sleep. Everything about serotonin is always good, so let's do it. Now let's think about governor vessel 24. Master switch to cranial nerves, but it's also open the skylight and pour in a bunch of chi at governor vessel 20. If we've got a lot of repair meridian pathways to cover, let's just soak up an extra dose of chi from above. Okay, so from there, I'm going to open up sky window. You know, sky windows, kind of lifting the burden from your shoulders, both mentally and metaphorically, so physically, literally. Stomach, 9, 10, 11, 12, plus SCM, sternocleidomastoid. This relates to pain all through here, so plus small intestine 16, 17. And you know, lots of people who have back pain have it because there's crunch here, and that means crunch down there. So let's just lighten the mental burden in another way. C1 right, C2 right, gallbladder 13 right, and C1 left, cervical 2 left, gallbladder 13 left. And governor vessel 22, the chemistry of calm. You know, it's kind of right in the soft spot where a kid's head would have the soft spot. GV22, oxytocin. This is also like getting a dose of Motrin 800 if you're in pain. So gallbladder 13 right and left, and governor vessel 22. Now let's start thinking about, well, a couple other places. Bladder 6, it's kind of deep hormone balancing. Tom's talking about it these days as part of mirror neurons, part of our learning process in the head. Bladder 6. And you can sometimes feel like tender spots, like the scalp feels pretty good, and then there's like an ouch, 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 like right here. That's bladder 6, and it's the motor neuron spot. Monkey see, monkey do. You watch somebody do something, somehow you're able to imitate that. So, BL6. It's partly how you experience Tong Ren. That's through the, I'm tapping, but you have the experience of tapping courtesy of the motor neuron spots. BL6, 7, 8, 9. BL6, 7, 8, 9. This is telomeres on immune cells, and that's part of an anti-inflammatory reverse aging process in terms of helping the telomeres, telomerase, lengthening the telomeres so that your immune cells last longer and they're able to go back, clean up a little bit longer and better too. So bladder 9, governor vessel 17, improves circulation, its blood pressure, its arteries, veins, capillaries, but particularly its circulation into all the nooks and crannies, all the way down to the big toe that you stumped on a piece of furniture. And now it's been hurting a few days. We got to reach that. Bladder 9, governor vessel 17. So let's come down, cervical 3, 4, 5. we're starting spinal arteries down, but let's make a detour. Let's detour partly through the shoulders, Tiandong. And there's nothing, like wearing your shoulders for earlobe ornaments when you're stressed. And doing that all the time. Or if you just have a job, you're a dental hygienist and you're doing all this, you're a dentist, you're a barber or a hair salon person, you're doing that all the day. So let's relax the shoulders through Tiandong. But the cervical 3, 4, 5 part, we're on our way to long thoracic nerve, thorax. So here's long thoracic and starting jumping in at lung 1, lung 2. This is all just like widen the chest, make more room for organ parts and function, but we just want to, again, get rid of the kinks and, So lung 1, lung 2, down into heart 1, kind of labrum of the shoulder capsule, rotator cuff area, lung 1, lung 2, both sides into heart 1. And let's go down to pericardium 1 and spleen 21. That's how to kind of help the long thoracic nerve all the way down. While we're there, and it's an easy spot to access, let's come across Tiandong of the shoulders again through heart 1. Let's just come down to the fingertips, all the way to the hands. We're kind of covering carpal tunnel, literal spots right here as we come down the arms. We'll do a little dust up at large intestine 10-11. I'm recording this in the time of COVID-19 virus, and it's one of the hot spots for helping immune globulins happen, which are going to finally suppress the virus, immune globulins out of your gut lymph. So let's also reduce inflammation a little. Kidney flush, kidney 27, 654, which side am I on here? And just reduce free radicals, which reduces inflammation. So here we go. And let's do a little bit of chest stuff, CV17, heart, lung. All right, now let's get back to, let's do another dose of Governor Vessel 23, 22, growth hormone, pituitary hypothalamic axis, but we're talking about repair cells or something if we're going to have to do some repair work on a bone surface like arthritis, or repair the muscles somewhere. And speaking of muscles, we'll move from Governor Vessel 23, 22, growth factors down right to top. GV21, motor cortex, master switch to muscles. So we're talking about tuning up tired muscles. We're talking about relaxing tight muscles. If something hurts, then you go like this and everything scrapes together, all that much more. Let's just do motor cortex and smooth all that up. GV20, a little sensory cortex, GV19, another method of relaxing the brain a little bit. 18 down to 17, we've already come. Sound cervical, 1, 2, 3, 4, 5. Do a little bit of C6 and a lot of C7, parathyroid hormone. It's calcium particle movements. Do you have some calcium graffiti in a joint? It shouldn't be there, but it is. So let's talk to thyroid hormones again, stomach 9, 10, 11, 12. Thyroid hormones by way of thyroid arteries first, and then C6, C7, parathyroid hormone as a movement to back clean up, get the calcium graffiti out of the way. And jump right into anti-arthritis, thoracic 1, 2, 3. Again, this is cleanup stuff that shouldn't be there. T1, 2, 3, good arthritis, 4, 5, heart, 6, 7. It's just, I'm a nutritionist. You can't pass by the gut for nothing. So T7, 8, 9, both sides, 10, 11, 12. And now let's jump in. Let's jump into lower body parts, hips and knees and ankles. So lumbar 1, 2, 3. and fan out across right over to the ouch point, lumbar 1, 2, 3. L3 starts the conversation with the knees, L4, L5, S1, and accented through bladder 30, 1, 2, 3, 4. We're kind of talking about getting to the top of the sciatic nerve through here, and then down to bladder 54, a direct treatment at the knees. So lumbar 1, 2, 3. So L4, L5, S1 getting to the bottom of the feet. And again, bladder 30, 1, 2, 3, 4, and 54. Down to ankle, literally right there. I think it's kidney 6, don't quote me on that. It's a remove cold, damp. So, you know, the weather changed and it's settled into your bones. Pretty sure it's kidney 6. But at least it's an ouch point to hit. Like, where does it hurt? Let's tap there. So let's come back also back to the front, right in the front of the pelvic region. Gallbladder 29 kind of almost corresponds with psoas muscle. So again, if that's tired, then your back tightens up because this part is not doing the work that keeps your pelvic in good alignment. Pelvic bone. So gallbladder 29, stomach 30, both sides. And let's come back down to the knees, coming down outside kind of the top of the quads, just top side. Down to stomach 36. And gallbladder 34, ligaments and tendons just below that. I have all kinds of itches here today. Gallbladder 34. And come on down. Let's again just talk to ankles and down to toes, down to spleen 6, liver 3, and kidney 1, standing in a bubbling spring of chi. Help things come down from the top to the bottom. Let me think of what else have we not talked about well enough. Let's again just do another little round of oxygenation. Frantic LI 17, 18. What are we up to here? 12 minutes. Let's make it at least a 15-minute dose of things here. Where are we going? We can repeat some more stuff. Headaches. It's really in the neurology video, but while we're here, we're talking about body parts hurting. So BL9, GV17, a lot of GV17. Just because it's a great spot for circulation in the head. We could do CN5 trigeminal at the front and CN8 in case tension in your brain is tensing your body, the mind-body connection. Let's do another big dose of chi to rinse down through. More GV20. And come back down. C1, 2, 3, 4, 5, 6, and 7. We'll just do the whole spinal column spa treatment. T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And lumbar 1, 2, 3, 4, 5, sacrum 1, 2, 3. A little more heart 1 in the shoulder, a little more C1, C2, tennis elbow, in case it's your serving arm that got messed up, and a little more shoulder stuff, tiandong and heart 1. We've done carpal tunnel wrist and kidney flush. Carpal tunnel is kind of an itis, so again, reduce free radicals. What have we done? I'm thinking of all the parts we've done coming down. Twisted and turn things, we've already done long thoracic for sort of, I pulled something along here. And another little more leg treatment, hip treatment. For, again, people that got a hip replacement. That's uncomfortable usually for a while, not as bad as a knee replacement, but we're hitting the hip part and coming down, gallbladder, stomach 30, 36, gallbladder 34, and liver 8, also for some ligaments and tendons. So now we're talking about the knee, the runner's knee, the knee replacement stuff again. Drain excess fluid, spleen 9, things are swollen, down to spleen 6, and back at the ankles and feet, toes. Again, if you have a neuropathy from chemo or from diabetes, this is a little bit of that, but you want to go watch particularly the neurology video and watch the immune system video, because that's what's batting cleanup for stuff that might have poisoned your nerves in case of a chemo, things like that. It feels like, God, there's like good smooth chi flow coming all the way down. And let's just finish, one little bit more. Just insular cortex, neocortex, gallbladder 7, 8, 9, 10, 11. If you're in chronic pain, that does a number on your head. So let's feed your head. There we go. And let's go back to gallbladder 13, right and left, and GV22, more oxytocin, more pain relief. And finally, upper, middle, lower dantian, just to charge the batteries and help you up, down to liver 3 and nourished, standing in a bubbling spring of chi from the earth, nourished from above and below, connected everywhere. And we'll finish. Let's just finish with a chime. All right, there's Tong Ren for all your body parts. Take care.